Hi, everybody. Thanks for joining me today. I'm Mary Thissen-Milder, and I'm with the Minnesota Department of Education. I'm the physical education consultant. Today, our topic will be general considerations for physical activity for youth. So let me get started to share my screen. So today, we are going to talk about considerations for physical activity for youth during the COVID-19 pandemic. This presentation provides a very brief overview of the considerations for physical activity for youth that are recommended by the Centers of Disease Control and Prevention. They include guiding principles to keep in mind to determine risk in different types of physical activities, how to assess the risk of spread during physical activities, identifying and promoting behaviors that reduce the spread, and steps that can be taken to maintain healthy environments for physical activity. There are a number of things to consider to help lower the risk of COVID-19 exposure and reduce the spread during physical activity. The more interaction with people, the closer the physical interaction, the longer the interaction, and the more sharing of equipment there is by multiple people, the higher the risk of COVID-19 spread. Therefore, risk of COVID-19 spread can be different depending on the type of activity. The risk of COVID-19 spread increases in physical activity settings as follows. The lowest risk of spread is performing skill building drills or conditioning at home, alone, or with family members. Risk increases performing skill building drills or conditioning in person with a group of people or a team from the same local geographic area. Risk increases with competition within that same group of people or team from the same local geographic area. And highest risk occurs with full competition between groups of people or teams from different geographic areas. The way activities are played and the way equipment is shared can influence the spread of COVID-19 among players. When you're assessing the risk of spread in physical activity, consider the physical closeness of players and the length of time that players are close to each other. Activities that require frequent closeness between players may make it more difficult to maintain social distancing compared to activities where players are not close to each other. For close contact activities, such as basketball, play may be modified to safely increase distance between players. It's also possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or eyes. Minimize equipment sharing and clean and disinfect shared equipment between use by different people to reduce the risk of COVID-19 spread. During times when players are not actively participating in practice or competition, attention should be given to maintaining social distancing by increasing space in between players on the sideline, the dugout, or the bench. Also consider the age of players. Older youth might be better able to follow directions for social distancing and take other protective actions like not sharing water bottles. For younger children, parents or other household members may need to monitor their children and make sure that they're following social distancing and take other protective actions. Another consideration for assessing the risk of activities is to assess individual players in the group or team who may be at higher risk for severe illness, such as children who may have asthma, diabetes, or other health problems. Activities with a large number of players on a team may increase the likelihood of spread compared to sports with fewer team members. Consider decreasing team sizes as feasible. Limit any non-essential visitors, spectators, volunteers, and activities involving external groups or organizations. Traveling outside the local community may increase the chances of exposing players, coaches, and fans to COVID 19 or unknowingly spreading it to others. This is the case particularly if a team from an area with high levels of COVID 19 competes with a team from an area with low levels of the virus. Consider implementing several strategies to encourage behaviors that reduce the spread of COVID 19. Players and families should be educated about when they should stay home and when they can return to activity. Actively encourage players to stay home if they've tested positive or are showing symptoms of COVID 19, or if they have recently had a close contact with a person with COVID 19. Teach and reinforce hand washing with soap and water for at least 20 seconds. If soap and water are not readily available, hand sanitizer that contains at least 60% alcohol can be used for staff and older children who can safely use hand sanitizer. Don't allow spitting and encourage everyone to cover their coughs and sneezes with a tissue or use the inside of their elbow. Used tissues should be thrown in the trash and hands washed immediately with soap and water for at least 20 seconds or use hand sanitizer. If hand washing facilities are available, support healthy hygiene by providing supplies including soap, paper towels, tissues, and no-touch foot pedal trash cans. Players should understand the use of face coverings. They are not intended to protect the wearer, but rather to reduce the risk of spreading COVID 19 from the person wearing the mask. As of July 25th, 2020, there's a governor's order requiring all Minnesotans over the age of 5 to wear a face covering in all indoor businesses and public indoor spaces and outdoors in situations where social distancing cannot be maintained. In reference to schools, the Minnesota Stay Safe Learning Plan for the 2021 school year, updated January 8th in 2021, states that it is strongly recommended that districts and charter schools require staff to wear face masks and face shields together when possible during the school day. Additional required mitigation strategies and tools schools must implement for any in-person or hybrid learning beginning January 18th of 2021 is that face coverings must be worn when engaging in indoor physical activity, for example, during indoor recess, indoor physical education class, or when exercising in a gym. For early learning in elementary schools only, all special lessons must be held in the classroom or outside when weather is permitting. However, physical education classes that can't operate in the classroom may continue to be held indoors outside the individual classrooms, for instance, in the gym, as long as students and staff are wearing face coverings. The following face coverings exemptions are identified in the Minnesota Department of Health COVID-19 sports practice guidance for youth and adults during the following activities. For gymnastics and cheerleading, if there are concerns about safety in regards to choking or the face covering getting caught on objects, students may temporarily remove the face covering during activities such as tumbling or flying through the air on certain apparatuses. However, students must wear face coverings for all other practices and routines. Individuals who swim, dive, or participate in water sports should not wear a cloth face covering while they're in the water. During wrestling contact, a cloth face covering could become choking or a visual hazard and is discouraged. For any further information on wearing face coverings during sports activities, please see the guidance from the American Academy of Pediatrics COVID-19 interim guidance on return to sports. Consider implementing the following strategies to maintain healthy environments. Clean and disinfect frequently touch surfaces on a field, the court or play surface, for example, drinking fountains, at least daily or between uses as much as possible. Use of shared objects and equipment, for example, balls, bats, or gymnastics equipment, should be limited or cleaned between use by each individual possible. Develop a schedule for increased routine cleaning and disinfection. Ensure safe and correct use and storage of disinfectants, including storing products securely away from children. Use products that meet the EPA disinfection criteria. Discourage sharing of items that are difficult to clean, sanitize, or disinfect. Players should not share towels, clothing, or other items they use to wipe their faces or hands. Make sure there are adequate supplies of shared items to minimize sharing of equipment to the extent possible. For example, protective gear, balls, bats, or water bottles. Otherwise, limit use of supplies and equipment to one group of players at a time and clean and disinfect between use. Keep each player's belongings separated from others and in individually labeled containers, bags, or areas. Avoid unnecessary physical contacts such as high fives, handshakes, fist bumps, or hugs. Continuing strategies for maintaining healthy environments, prioritize outdoor as opposed to indoor practice and play as much as possible. If playing inside, ensure ventilation systems or fans operate properly. Increase circulation of outdoor air as much as possible. Increase circulation of outdoor air, by example, by opening windows and doors. Don't open windows and doors if doing so poses a safety or health risk, for example, risk of falling or triggering asthma symptoms to players or others using the facilities. Take steps to ensure that all water systems and features, for example, drinking fountains or decorative fountains, are safe to use at a prolonged period of time. Drinking fountains should be cleaned and disinfected, but encourage staff and players to bring their own water bottles to minimize touching water fountains. Provide physical guides such as signs and tapes on floors or playing fields to make sure that players remain at least 6 feet apart. Close shared spaces such as locker rooms if possible. Otherwise, stagger use and clean and disinfect between use. Also, limit the number of players sitting in a confined player seating, such as dugouts, by allowing players to spread out if more space is available. This presentation covered general guiding principles to keep in mind to determine risk in different types of physical activities, how to assess the risk of spread during physical activity, identifying and promoted behaviors that reduce the spread, and steps that can be taken to maintain healthy environments for physical activity. Thank you for listening. Keep in mind that requirements and recommendations, these are fluid with the ebb and flow of the COVID-19. Please check the Centers for Disease Control and Prevention's websites and the Minnesota Department of Health's COVID-19 website for the most current information regarding guidelines for physical activity. Thanks, everyone, and I hope you have a great day.